treating Sophie today. So we're going to have a look at her skin, have a cleanse first, and we're going to use the facial electrics machines on her today. She has said about her congestion and dehydration, so we're going to get a closer look when we do our skin analysis. So first cleanse, as always, creamy cleanser, lift off the makeup. So we're going to do 2 pumps. So we want to see how Sophie's skin reacts. So we always go with the gentle clean cleanser. This will also degrease the skin, lift up any makeup. It's the perfect first cleanse. So we're making sure to do chest, neck and face, including all the areas. So swipe in, swipe out, long, slow movements. Corner of the nose, up into the forehead, and off. So when you're cleansing, you get your sponges, put them between your 2 fingers, dab your hands. Okay, and we've given 1 wipe off. We'll just give another wipe off to make sure it's all cleaned off, that there's no residue left on the skin. And if you need to do eye makeup, you can bring the eye cleanser first, and then you can just wipe off. This is gentle enough to use for mascara on the eyes or eyeliner. Okay, so next step is skin analysis. So we're going to just blot dry the skin so there's no water left on the skin, so we can look at the skin properly and correctly. We'll do a swap. Okay, so starting forehead, we're going to look at her skin. We're going to look to the side, and we can see a little bit of congestion underneath the skin. You can see a little bit of bumps. You can see dehydration when you pinch between the lines, and just open pores in this area. So congestion, open pores, but also quite dehydrated. And her skin type is a thinner skin that's more prone to dryness, but quite a lot of congestion as well. So nose, little, not too bad with congestion. I'd say there is a degree of congestion there that would say that she needs to change her cleanser and exfoliate a little bit more. But once that's done, then her nose and chin will be a lot more clearer. We're going to check for elasticity. So lifting up, you can see, first of all, your fine lines from dehydration, but also the bounce back of the skin. So there's a little bit of elasticity lost. Nothing that you can see on Sophie's skin yet, but it is good to work on to prevent aging in the future. You can also notice one side is a little bit more lost elasticity than the other side, which is normal. There will always be one side worse than the other. So what we're going to treat today is we want to exfoliate the skin to decongest these areas. We're not going to extract or steam because her skin type is more dry and dehydrated. If we steam, it'll cause the broken capillaries to become worse. If we extract, we're not going to get anything out because the pores are so tight and there's a lot of excess keratinization in the area. So we need to work on decongesting in another way. So we're going to exfoliate the area, then we're going to hydrate using the Galvanic, and then also we're going to use a bit of muscle stimulation to lift and tighten. Okay, so we are going to do a second cleanse on Sophie. Now I'm going to use the gentle clean for this one because her skin is dry and dehydrated, even though she'll probably feel that it's a little bit oily because she has congestion and breakouts, but it is more prone to the dryness and dehydratedness, and it's quite thinner, so we don't want to be aggressive with our glycolics. So what we're going to do is we're going to use the gentle clean again. So 2 pumps. Add a little water to it. So clean the chin, clean the nose, around and off. We're going to give it another little rinse. So when you're using a creamy cleanser, what it will do is your water is going to change the pH of your skin, so it's going to adjust it slightly to dehydrate it, and the creamy cleanser is basically making up for that adjustment. So if you're dry and dehydrated and you use a foamy wash, the foamy wash will generally change the pH of your skin a little as well. So that on top with water means it's going to dehydrate the skin quite a lot. So it's important that you are using, during the winter, you need to use a creamy cleanser. And also if you've dry or dehydrated skin, you need to use a creamy cleanser. Or if you wear a lot of makeup, you should use a creamy cleanser first before using your wash. And off. Okay, next step then is our exfoliation. We only do 1 pump. We keep a small amount because we don't want to cause a lot of the grains to be on the skin. So this is a glycolic quartz. We've done a small amount with a lot of water so that it's not scrubbing the skin too harsh. And if you feel your skin dragging when you're moving it, you need to add more water. And add a little bit of extra water to that. making sure to clean out the congestion around her nose and chin. Okay, and then we're going to rinse that off. Don't forget to dab it down. So now, need to make sure it's off. I'm just going to have a feel. I can feel there's a little bit of granules. So we want to give it a little rinse. So we rub in a little water to lift up the grains, and then we wipe the grains off. Okay, so we are good now. Just going to dry off her skin. So our next step is Galvanic. So what we're going to do is we're going to use Galvanic iontophresis. So this is using electrical current, using positive and negative polarities to draw the positive and negative polarities towards each other, thus pushing the ingredient more into the skin. So we're going to give Sophie one of the electrodes, and we're going to explain to our client this is going to feel a slight tingling or prickling on the skin, and it won't be uncomfortable, but we will assess how you're feeling with it. So we're putting wet gauze around, and then we're, okay, give me 2 seconds. So Sophie's gonna, now you can put your wrap hold at that and relax your arm down. Perfect. Okay, so that is the negative polarity. Now we're going to have the positive polarity. So I prepare my rollers by having them beside me. Okay, so we're going to apply the gel. So this is a special ionized gel that goes with the Galvanic. This is using rose water to help hydrate the skin. So we're going to apply a thin layer all over. Okay. So now what we do is we place one roller. So this is going to be our positive polarity. So this means this is attracted to the negative polarity she's holding. So whatever's in between, the ionized gel, whatever's ionized in between, it'll push it into the skin. So we're going to place the roller on her cheek. We're not going to turn it on until we've placed it on and we're rolling. So we're just going to turn the machine on. So we're going to check with Sophie. How's that feeling?
Yeah, it feels good.
Does it feel tingly?
A little bit, but not unpleasant.
Okay.
I feel it, but...
So that's what we want with her. So we're not going to turn it up too much. We just turn it up a bit because she needs to feel like it's there, but it's not going to be uncomfortable. So now we're going to introduce our other roller. You can do with just one roller if it's easier. Sometimes with coordination, you have to make sure that you can work 2 rollers at a time. Also, do not touch off each other. This is why roller is actually easier with just one roller. So what this is doing now is pushing it using the electrical current and opposite polarities to push the products into the skin. And you can see in the areas where she's very dehydrated, temples, around the eye area, it's evaporating into the skin very quickly. We're going to work on her forehead because also she's quite dehydrated here. And you make sure that you don't touch off each other and you don't lift. So you do this for, again, 3 to 5 minutes, depending on how quickly it evaporates into the skin. And we can see it's evaporating quite quickly. So that's good. She's going to be nice and juicy and plump after this. Okay, and then to turn it off, so we're going to place one roller down, and then we're going to go to the machine, and we're going to turn the setting back down, and we're going to turn it off. And that is it. And place that back. Sophie, I'll take that back off you. Thank you. Now, also as well as we're going to get rid of this gauze, and we're going to change our gloves, just so that we're making sure we're completely hygienic, because we did touch a probe that has touched Sophie's hand. So we'll change our gloves. And what we're going to do, I'll cover you, there you go. So what we're going to do now is we're going to tone this off, and then we're going to do microcurrents to lift and tighten. Okay, so we apply a rose water toner, which is just to rebalance the pH. So we're going to apply another gel. Now this is a microcurrent gel that you use specifically for muscle stimulation. So we're going to apply it to the areas we need to work on. So a nice thick layer. The more conductive this is, so the thicker it is, the more conductive it is, the better the results. So we're going to use the lift for jawline to lift and tighten, but then we're going to use the eye tight for around the eye area. So this won't feel uncomfortable. You might feel a mild muscle spasm, but it won't feel painful or anything like that. So we place it on the jawline, we turn it on, we turn it up to the max, hold it there, and once it beeps, we move on to the next area. Now Sophie has a smaller face, so it's only 4 movements with hers. But basically you're covering the whole cheek area. And then depending on the client and the degree of laxity, this is between 3 to 6 times. So Sophie's young and her skin hasn't become lax yet. So we're going to just do the 3 times because it's more for a preventative measure. And just do the last one. I'm just doing a little extra one. So sometimes if they have a lot of fillings, they'll feel it through their teeth. So you have to warn, especially on this movement right here. Okay, so we're going to move to the other side. That's already a little bit lifted and tightened already. So I'm going to place. So what this is doing is it's getting the muscles in the face to work out. So it's causing them to move. And over time, as we age, our muscles become a lot more lax, also with lack of circulation to the skin. So this is going to cause the muscles to work out again, to lift and tighten, and also increase circulation to the muscles, to feed the muscles and the skin. So the results are amazing. And if they take this and do this at home once or twice a week, they'll have amazing results with it. Okay. Okay. So now we've done the lower face lift. We are going to do eye tight for around the eyes. So what we want to do, this is using your muscle stimulation, and also it's using clip technology to help drain away the area and stimulate your lymphatic system and your circulatory system. So again, feeding, detoxing the skin, feeding the skin, and then getting your muscles around your eyes to work out, to open them, to give them much brighter eyes. So we love this during treatment because clients will see a result instantly with it. So they'll be walking out with brighter, tighter eyes. Okay, so we're going to keep that on low. This is the clip that will move things along, and our microcurrent is on the other side. So we're using clip technology and EMS. The clip technology moves the lymphatic system to detox around the area for fluid retention, and also it stimulates circulation to the area to feed the skin. Then we're using EMS on the other side, which is muscle stimulation coming through here. So we're just working around the eye area to drain. So after we finish with our eye tight, what we're going to do is tone off the excess gel. Now, as a drier type of skin type, depending on your timing, you can choose to do your massage before your muscle stimulation or afterwards. I choose to do my muscle stimulation at the end of the treatment so that they leave with a lift and tightened skin. Now, for finishing off, we're going to moisturize an SPF, but Sophie has dehydrated skin, but she also has a bit of congestion. So putting a moisturizer on her skin is not going to help. So we want to hydrate her skin without covering it in oil, which then will just clog her pores and make her congestion worse. So what we're going to use is we're going to use Aqua Plus, which is the hyaluronic acid serum. So this attracts 1,000 times its own weight in water. It is the feeding or nourishment or housing for your collagen elastin. So if you do not have enough hyaluronic acid within your skin, your collagen elastin can't be stimulated with these treatments. It'll give a nice dewy look post-treatment. And for maximum effects, you would do it with a skin roller. So we'll rub this in. And then we're going to use just an SPF. Nice thick layer of SPF to protect the client. Now, and what we're going to do is we're going to show our client in the mirror how her skin is, give her suggestions of what she should be using at home, and then give her her aftercare. And that is the treatment.